From the New England School of Communications on the campus of Husson University, this is the Maine Report, the way news should be.
Hello and welcome to the Maine Report. My name is Calvin Cutler. Bangor is one of many cities in the Northeast dealing with a widespread opioid epidemic. Bangor Public Health and Community Services is now teaming up with Penobscot Community Healthcare for an educational campaign called Knowledge is Power to combat the crisis. My guest today is Heath Myers, the Overdose Prevention Coordinator for Bangor Public Health. Heath, thanks for joining us.
Thanks for having me on today.
How are we doing today?
We're doing pretty good.
Good, glad to hear it. Before we get started, actually, I just wanted to roll a short PSA that you guys produced over at Bangor Public Health. That's all right.
Yeah.
Cool.
Pain. It's never easy to deal with. Opioid medications might seem helpful at first, but can transform into a different problem. Pain medications like opioids can be addictive, and addiction can happen to anyone. It can hurt your family. It can hurt you. It's so important to know your options. Discuss them with your doctor to find the best fit for you. There are many alternative treatments available for your pain, solutions to help you heal and get back to doing what you love. Asking about your treatment options is worth it for you and your family. It's your body, it's your health. Knowledge is power.
And so again, that was a preview from Bangor Public Health, a PSA talking about the new campaign, Knowledge is Power. So Heath, what exactly is Knowledge is Power, the campaign?
So Knowledge is Power is really a campaign that's designed around the realization that there needs to be a lot of education around opiates. Because for a long time, there are medications that we thought really didn't have a risk of addiction, didn't really have any sort of risk to our health. And our doctors are realizing that's different. And that information is not exactly accurate. And so now we're trying to get that information out to the individuals and the public as well to say opiates are effective for certain types of pain and for certain types of conditions, but overwhelmingly for people who have pain, we don't have evidence to support the fact that opiates are safe, that they're effective, and we know that there are other options out there as well, and so we want to highlight those other options.
So it's sort of an initiative to start a conversation with one's doctor, if you
Absolutely. We're hoping to, one, encourage people to have that conversation, provide them with some of the basic tools that they might need and some information, and also just to really empower them to take control of their own healthcare decisions and to know, it's okay to ask questions, it's okay to ask for a second opinion, and it's certainly okay to not want to have your pain management be opioid-based.
What are some side effects of opioid painkillers?
Sure. So some of the side effects that we're most familiar with is there's certainly a risk for addiction. It depends on what study that you're looking at, but usually dependency sets in 72 hours. And so what dependency means is that when you remove those opiates from your body, you will go through withdrawal. Now that alone doesn't mean that you're addicted to the opiates. It just means that your body is withdrawing from them. If you're addicted, you'll have a psychological compulsion to go use opiates. If you're not, you might hear something from your doctor like, well, we think another medication might work better to manage your pain, and you'll probably say, okay, let's try that. Beyond addiction, some estimates are about 1 in 3 people who are prescribed a high-dose opiate in a long term are going to struggle with addiction. Besides that, there's also the real possibility of overdose, especially when prescription medications are combined with things like alcohol, when prescription medications are not taken at the correct time, or there's another class of drugs called benzodiazepines that they both depress your central nervous system and they can both cause an overdose, especially when they're used together. Besides the possibility for addiction and overdose, there's other side effects, such as it can actually make you feel your pain more, like it makes you more susceptible to feeling pain. It makes it harder for your body to use its natural abilities to fight the pain. And then there are some secondary things like oftentimes people have constipation. Sexual dysfunction is another one. But to get like a full list, you can certainly check out the campaign and ask your doctor about it.
So it seems like a lot. Why are opioid prescriptions given out so easily nowadays?
Yeah, so we're kind of at a place where that's shifting. And what happened really, and you can look kind of back into the HIV/AIDS epidemic, there was a real undertreatment of pain. So during that time, there were a lot of misconceptions, like babies don't feel pain, or older people don't feel pain, so there's a massive undertreatment of pain. So many people died, especially during the HIV/AIDS epidemic, really horrible deaths that were really unnecessarily painful. So around that time, people were like, we really need to pay close attention to pain. A new pain medication came out. So doctors were, something that they were told needed to look at now, something they were told they need to prescribe to all types of pain, not just cancer pain or HIV pain. And then they also were told, well, and this won't cause addiction. There's like a 0.1% chance of addiction. So all of that set up the place where a lot of people were prescribed opiates for a lot of different reasons that were oftentimes unnecessary. Now we're at a place where we're recognizing that is not where we want to be, and we're trying to scale back the amount that we're prescribing opiates. And certainly the doctors are getting that education. And that's why we're trying to provide it to the public, is because we really want both the doctors and the public to understand what it means to be on opiates and when they should be used and some of the risks, because we're all better off when that happens.
Well, I mean, we've got about 45 seconds left until break here, but how do we go about educating these doctors?
Sure. So the doctor, the professional organizations are doing a lot to try to get the education out there. The CDC has put out new guidelines. There's a new law in Maine that is really going to require doctors to learn so they can prescribe it efficiently. But there's lots of mechanisms, and they are happening. It just takes a little time.
Cool. All righty. Well, we're going to take a short break. When we come back, we'll continue to discuss opioid addiction, and we'll also talk about painkiller alternatives. We'll be right back.
Right, mi cariño. So like I said, everything I learned about cooking, I learned from Grandma's empanadas. Shall we go again?
Yep.
Mix the beef with the onions with the peppers with the paprika with the garlic with the oregano with the cumin. Got it?
Got it.
Throw in the olives, stir, season, stir again, pour out the flour, roll out the dough, make a circle, drop in a fistful of filling, fold over, press down, and ta-da!
Most parenting is hard to do in just 2 minutes. But 2 minutes twice a day making sure they brush is easier, and it could help save them from a lifetime of tooth pain.
They'll test you. Try to break your will. But however loud the loudness gets, however many cheese puffs may fly, you're the driver, the one in control. Stand firm. Just wait. And move only when you hear the click that says they're buckled in for the drive. Never give up till they buckle up.
Hello and welcome back to the Maine Report. My name is Calvin Cutler. Our topic today is the new educational initiative from Bangor Public Health and Community Services called Knowledge is Power. My guest today is Heath Myers, the Overdose Prevention Coordinator. Heath, welcome back.
Thanks.
So before we get started on this segment, actually, we have a full screen graphic. It has overdose death statistics of opioids. I just wanted to take a quick look at that. So needless to say, around 2002, 2003, there's a huge spike in overdose deaths of opioids. How can we explain this, do you think?
So that particular spike is really connected to more people being exposed to opiates through more people being prescribed it, and so more people at risk. And a lot of that spike had to do, too, with people weren't given or weren't connected with education about the risks, about what can cause an overdose, about what an overdose looks like. And so those people were more likely to die when that kind of thing happened. We're still seeing a pretty big increase, and the reason now is because as we get better at prescribing prescription opiates and they're less available, heroin pretty much works the same way in your brain, and it's pretty hard to tell the difference, especially if you happen to enjoy opiates. So people who can't get prescription opiates are now turning to heroin, and where at least with prescription opiates they had a better sense of what they were getting and what kind of stuff and what the strength was, they really don't have any idea with heroin. And now there's a stronger drug called fentanyl that's often being sold as heroin. So we're kind of like in a perfect storm that's all creating the conditions where we're having a lot of overdoses.
I see. And so when it also comes to treating pain on an individual basis, so there's many different alternatives which you can use instead of opiates. Do you want to talk about a few?
Yeah, sure. So and when you think about the kind of psychological component of pain, like how it feels mentally, there are things like cognitive behavioral therapy, things like mindfulness, things like yoga. When it comes to the physical side, there's different medications that are non-opioid based. There's also anti-inflammatory medications that oftentimes help with the pain. And then there's physical therapy and yoga, again, it's kind of on the physical side. So lots of things that people can do to improve the function while reducing the pain.
And of course, these alternatives aren't for everybody. It's, again, as you said, it's a dialogue between the patient and the doctor.
And absolutely, it's absolutely a dialogue. And part of that dialogue, if you are on opiates, is to ask, what does an overdose look like? And I can get into that really quick right here. Sure. Well, an overdose, one of the first things you'll notice is somebody is snoring louder than they used to. So I always say, my partner, she snores every night. If she was snoring really, really loud, I'd be concerned if I knew she was using opiates. I don't snore at all. If I started snoring one night and I was using opiates, I'm probably having an overdose. So snoring is one thing. You might notice blue lips, pale face. You might notice the breathing is really slow or not happening at all. Those are all signs of an overdose. If you see those signs, you really should call 911. If you have naloxone available, which is an overdose reversal drug, something you can get from your doctor, which can also be part of that conversation, it's something that you should use. And it will help reverse that overdose, but it's only temporary. Only works about 30 to 90 minutes, and the opiates will last longer. So make sure you call 911, get medical help there. And while you're waiting for medical help, if the person's not breathing, and especially if you don't have naloxone, you can use CPR, and that will really help them as well.
I was going to say, I feel like there's a certain stigma that overdoses are just associated with heroin. Are overdoses possible, I suppose, with prescription opioids as well?
Sure. So last year, only about 9%, but that's really, think about it, 1 in 10 of all the overdoses happened for a prescription that would belong to somebody. Typically what's happening in those is that they might be on a benzodiazepine and it might interact poorly. They might be drinking alcohol, which isn't good. It could just be that the body it's the first time they've tried opiates or used opiates. It could be that the dose is increasing. There's lots of reasons why somebody who's using prescription drugs can overdose. And when really, too, even when it comes down to heroin, you can really connect those overdoses to some pretty distinct risk factors. It's not just the people who are using. Again, mixing the drugs, benzos and alcohol, especially big time, really big risk factor is relapse, especially after someone has tried to go through detox and had some time in sobriety. Their tolerance is low, and if they relapse, they're very likely to die. So it's a good time to be watchful over somebody if you know.
I see. And also when it comes to taking prescription opioids as well, you said earlier that, there are some things that do, well, nothing mixes well with it, of course, but there are some things which can be potentially fatal when you mix with it.
Yeah, so alcohol is very dangerous. Alcohol actually, the way that it works in your body will reduce your tolerance to opiates. So whatever is the dose that is getting you whatever you're looking for gets closer to the dose that will kill you. The other drug is benzodiazepines. So both of those drugs slow down your central nervous system, your breathing specifically. And when they're used together in combination, it just magnifies the effect and makes it much worse and more likely that it'll cause an overdose. Those are the two major drugs that you really want to ask your doctor about.
I see. And we have just about a minute and a half here left. Is there anything that you'd like to say for people that are struggling with either heroin addiction or opioid addiction? What can you say to those people?
What I would say to those people, and I'd also say to their families, is that recovery is not an endpoint. It's much more of a process. So if you've tried to stop using opiates, or if you've even tried just to control and reduce your opiate use, and you found that it didn't work for you, it's not because you're a failure, it's not because you're hopeless, it's because whatever you tried to do didn't work for you. So there's lots of different types of treatment. The most effective that we know of are medication-assisted treatment. If you can get into one of those areas, that would be great. It can be really hard, though. But to just understand that when a relapse is not a failure, it's not a sign that you are outside of the realm of humanity or that you're a bad person or a failure. It really just means that you need to readjust and you need to try again in a different way, especially because that's probably what you want for yourself, is to get past this and to not have problematic use.
I see. Well, Heath, thank you very much. That's all the time we have for today. That wraps up this edition of the Maine Report. I'd like to thank my guest, Heath Myers. I'm Calvin Cutler, and thank you very much for watching.